Working as an equine dental technician for well over a decade, I take for granted what I do day to day. I'm very lucky I get to work with some lovely horses and spend all my time outside in the countryside. It all sounds very idyllic until it's raining or -5. But what actually is it that we EDTs do? My non-horsey friends would assume that I do composite bonds and teeth whitening, but when I did ask a bunch of my regular customers, aside from responding with mostly chatting and quite a lot of tea drinking, I was quite happy that the answers were often centred around the word prevention. And essentially that's it, preventing the progression of more significant dental pathologies, with the focus around aiding performance and improving general health. And today I'm going to highlight all the steps involved in the role of an EDT and hopefully shed some light on what we actually do. So, first step is a safe and thorough inspection. Now this obviously includes checking their teeth, but also identifying any abnormalities around their head and mouth. Horses are naturally quite stoic animals and quite easily disguise pain, making it hard to diagnose dental problems. A well-rehearsed checkup will cover all the areas to identify or rule out any issues. First and foremost, we have to make sure that we're safe when doing this. For example, we need to remove some water buckets or the hay net that's hanging up. So the very nature of our job has elements of danger. We're working with large, unpredictable animal, so safety should be at the forefront of our minds, constantly analysing each situation to make sure that we can do our job correctly. So the next decision is handler in or out. Personally, I feel safer in full control of the horse, but this is totally down to the dentist's discretion. Some people like a handler, but others don't. But again, safety of yourself and others should be the overriding decision in these situations. So next is the general inspection. This is before the speculum goes on. We're trying to gather history, check any previous dental notes or if there are any problems eating or performance issues. This helps to build a treatment plan and you can get a feel for what areas you might need to focus on. Next, we move on to the physical inspection. So these are head checks, the incisor checks. In this step, we're getting to know the horse as well as assessing for any abnormalities. We are discreetly checking their behaviour to see if they need sedation or not for the next stage. We move on to the oral inspection. Once we're happy that everything's normal, we pop the speculum on and we can systematically check for dental pathology. Now one caveat I should mention is if we do find any problem here, say a loose incisor, well that's the whole point. We would then be able to treat whatever it is that we find. It's not always about rushing in to rasp their back teeth. So assuming everything's normal, we can then move on to the next step. And this should only take a few minutes, but we aren't rushing into their mouth trying to feel the teeth. We need to flush out the teeth with a dose syringe like this to make sure there's no food or anything obstructing our view when we're inspecting. We're using a variety of dental equipments, so we've got mirrors, probes, anything like that which is going to help our inspection. And this should provide you with enough information to perform the next step, the actual treatment. So, first things first, is sedation needed? It's not always necessary, and when the horses have had regular dentals, it quite often becomes a normal part of their routine and will be accepted, similar to seeing the farrier, and in lots of cases better behaved than when their owners are seeing their own dentist. So, basic rasping are and should be part of a routine checkup. Unlike us, horses' teeth constantly erupt, and due to the three main dental tissues, enamel, dentine and cementum, which wear away at an uneven rate, causing the hard enamel to become overgrown and eventually sharp. If you subscribe to our channel, we have another episode on this topic describing how and why this happens in more detail. So in a routine situation, we'd expect to find some normal overgrowth that's perhaps beginning to get a little sharp and needs addressing. Now, unfortunately, treatments aren't always routine. They can become advanced. And this is possibly caused by missing dental appointments, going overdue, or it could be down to changes in diet and management techniques. The next step is the follow-up treatment. This is actually a very important part. It reiterates the treatment that has just been carried out, so you can do the best job in the world, but if you never see the horse again, the teeth will eventually become untidy. This is especially important for the advanced cases that take years to develop and therefore can equally take years to correct. This role of communication applies to cases of dental problems that need the owner's input. For example, periodontal disease or peripheral decay, situations that may require dietary changes to treat and improve. When relaying information, we don't read too over the top that it's unbelievable and they might feel like they're being taken advantage of. Likewise, we don't want to be too relaxed that problems are ignored. Finding that balance not to frighten or panic an owner, but to stress the importance of regular dentals can really have an influence on fixing a dental problem. It's essential to keep a confidential clinical history. They can be paper notes or digital, it doesn't really matter as long as they're completed after each treatment. I personally prefer to record my notes on my iPad. It helps to keep things organised and easy to email between customers and to their vets if we need to refer. I think it goes without saying, good hygiene is an important part of our role. This relates to our clothing. They can be scrub tops, aprons or overalls, basically anything that can be changed between yards to avoid any biosecurity risk. Also making sure our tools that are used are clean and properly disinfected in between patients and especially in between yards. I think there are some days I spend more time cleaning than I spend time working. The next and final step is ensuring continuing professional development, or CPD. This can be via either practical or theory-based courses, reading, lecturing, basically anything that will further your knowledge to make sure you're staying relevant. Dentistry has evolved hugely over the last 10 to 15 years and is continuing to evolve as more studies are being conducted. CPD is a requirement to remain a member of the Dental Association, as well as regularly having our practical work assessed. We, as EDTs, have to be confident that our finished work is of an appropriate standard. And practical work assessments basically do just that. Our work is essentially analysed by our peers. This should take place a minimum of once every 3 years, but I say most EDTs do more than is necessary, as it's also a good chance to catch up and discuss cases. I hope this has provided you all with a broader look into what we as EDTs do and what our role is in the industry. Being responsible for the horse's dental care is not just for the treatment, but for the in-between treatments, the advising, explaining, referring, educating. It's not just a job, it is a way of life. And I know this to be true because when you get a group of EDTs, I don't know what the collective noun for a group of EDTs is, maybe a set, like a set of teeth. So yes, when you get a set of EDTs together, all we talk about are cases and teeth and our treatments. I think that takes us back to our true main role, chatting and drinking tea. Please like and subscribe, and please also share with your horse owning friends. Thank you.